How does Medicare work with group health insurance coverage? Which plan is primary and which is secondary? Should you even sign up for Medicare? We'll answer all these questions and more coming up next. Andy Stamus here with Medicare Mindset. When you're covered in a group health plan and become Medicare eligible, you might not know what to do. Should you ignore Medicare and stay on the group plan? Keep both Medicare and the group plan? Or leave the group plan and go fully on Medicare with supplemental insurance coverage? This video will break down the important considerations you need to think about. The number of employees at an employer and how you are eligible for Medicare are the primary considerations. Is it a large employer or a small employer? And are you Medicare eligible based on age, disability, or kidney failure? Here we have the situation of turning 65 and being covered in a large employer health plan with 20 or more employees. The primary coverage is the group health plan, and the secondary coverage is Medicare. So in this case, you really don't need Part A or Part B. However, some enroll in Part A only because Part A doesn't have a monthly premium. But keep in mind that any enrollment in Medicare will prohibit you from contributing to a health savings account with any size employer. We highly recommend not enrolling in Part B in this situation, as Part B has a monthly premium that you would pay in addition to your group health plan premium. Save the money and instead enroll in Part B when you absolutely need it. For example, when you leave the group plan at retirement. And you can do this without penalty because of being covered in a group plan based on your employment or a spouse's employment. Watch our video titled How to Enroll in Medicare After 65 for guidance on how to make the transition. Here's the same situation of aging into Medicare at 65, but this time your employer has under 20 employees. Coordination is reversed. Medicare is primary and the group health plan is secondary. This means you need to enroll in Part A and Part B when in a small group plan. Some group plans have a premium discount if you have Medicare as primary, so be sure to check with your employer's benefits department. Now let's look at a situation where you're eligible for Medicare due to a disability. In this scenario, the breakpoint is different. The employer needs 100 or more employees in order to be considered a large employer. So 100 or more employees could make the group health plan primary and Medicare secondary. But under 100 employees would make Medicare primary and the group health plan secondary. Medicare based on end-stage renal disease, ESRD, or kidney failure can get incredibly complicated, but this section will simply focus on the coordination of benefits when also covered in a group plan. In this scenario, the size of the employer doesn't matter. The coordination works like this. ESRD Medicare typically starts on the 4th month of dialysis treatments. Only at that point will Medicare kick in. So that's where this section begins. You'll see the first 30 months, which is called the coordination period. During this time frame, a group health plan, or COBRA coverage, is primary, and then Medicare is secondary. After the coordination period, it flips. Medicare becomes primary, and the group health plan, or COBRA, is secondary. Now I just mentioned COBRA continuation coverage. I'll explain what that is, and then we'll wrap up at the end with a list of all items to consider. COBRA is a continuation of group health insurance coverage after separating service from an employer. Coverage is typically extended for 18 months, but can sometimes last for 36 months. COBRA can be expensive because you're paying 102% of the gross premium for the group plan. You do not get a premium subsidy from the employer, since you're no longer employed with them. But sometimes it's more appealing than an Affordable Care Act plan because those plans can often be more expensive than COBRA and have less coverage. If you're Medicare eligible based on age or disability and on COBRA continuation coverage, Medicare is primary and the COBRA plan is secondary. So this means you need both Part A and Part B. Now we'll finish with a list of all considerations to take into account. The first two we have already summarized at length. You'll also need to consider the type of health plan you have. Is it a traditional PPO with mainly copay requirements, or a high deductible plan that you have to pay several $1,000s up front before the plan provides coverage? Are you contributing to a health savings account? You may like to load up this account for the tax savings and to pre-fund future health expenses. How does the group plan premium compare to what you would pay while exclusively on Medicare with supplemental coverage? If you can pay about the same premium or less while on Medicare, you'll want to consider leaving the group plan. Your income is part of this too, because it determines what your Medicare Part B premium will be. There's a standard Part B premium, but then it goes up from there based on various income ranges. What's the group plan's medical deductible and maximum out-of-pocket limit? If both of these are high, you may find Medicare more appealing. Whether you're a low or high utilizer of medical and pharmacy services can play a big role in the decision. Sometimes it's more appropriate to keep the group plan, and others it's beneficial to go on Medicare. If you have a younger spouse on your group health plan who is not Medicare eligible, you may need to delay Medicare and stick with the group plan. You also might have a retirement date in mind coming up in the very near future. If so, comparing Medicare versus the group plan is not needed. You'll plan accordingly and make the transition to Medicare. Is the prescription drug coverage in your group plan creditable or non-creditable as compared to Medicare Part D minimum standards? If it's creditable, you can delay Part D without penalty. If it's non-creditable, which can happen often, you could accumulate a Part D late enrollment penalty. Contact us for help on this. And lastly, are there other perks from the employer that are nice, such as reimbursement on a specific dollar amount of services, or money the employer puts in your health savings account? Hopefully you have a better understanding of whether transitioning to Medicare makes sense in your case. If you need more information on this topic, watch our video called 4 Reasons Why You Should Delay Medicare.